Whether you're an athlete, a weekend warrior, or someone who doesn't exercise at all, the body has an ideal way that it moves. For the most part, everybody's body is supposed to move the same way. It's a perfect system of physics, your musculoskeletal system.
Sometimes, however, that system may function less than perfectly. Pain is the body's way of signaling that something's not right. It's important to determine the underlying cause of such distress. Oftentimes, a chiropractor can help get to the root of the problem.
So sudden, severe pain that's kind of come out of nowhere, never experienced before, you really can't tell what's going on, you should go and see your primary care doctor. Rule out anything more significant. When your primary care is kind of at a loss for what's going on, which tends to happen, especially if it's truly a musculoskeletal problem, then you can come to see us.
Sometimes just the daily routine of life is enough to throw things off balance.
We tend to sit too much as a society, and so we tend to start having our shoulders come forward, our necks and heads come forward, and then because we need to now look up, our heads will come up, and then that's actually a big cause of headache. Very common symptoms that people come in with are headache, pain along the neck in general, pain along the shoulder blade, on the inside of the shoulder blade, pain at the top of their shoulder, pain across the middle back or in one particular spot in the back of their hip.
Pain should never be considered normal and should not be ignored.
Pain is the last thing to develop. It's the first thing to go away with a biomechanical problem. So typically, a problem was there for quite a while before your body started saying, all right, we're having a problem here. Here's some pain to tell you to pay attention to it. When people first come to see me, I do a very comprehensive examination. So I'm not only going to just touch your spine and find out what areas of the spine might be stuck. I'm also going to, move your arms around, move your hips around, move your feet, your knees around. We're going to see how your whole body moves. Sometimes I have people doing squatting and lunging just to see how they move through that patterning. And then we ask, what are your goals? Okay, do you just want to get out of pain? That's fine. That's a goal. Do you want to start running? Do you want to be able to play with your grandchildren on the floor and be able to get up and, not feel like you're having a tough time?
Based on that conversation, the chiropractor develops a treatment plan.
So my role is to open up the movement, open up the available movement into your body that your body has lost. In your neck, in your upper back, in your shoulders, in your lower back, in your hips. Do you need adjusting? What type of adjusting do you need? Do you need to have some muscle release done? Then it's my job to now not only assign you exercises, keep track of it, show you how to do it properly, check on it, make sure you are doing it properly, because I think what people don't realize is the answer lies in the details. Like planking is a common exercise that people know about. It's an excellent exercise for their core, but if somebody hasn't walked you through where you should be feeling it and what muscle should be holding you in that position, they tend to use the opposite muscle groups to actually hold them, because that tends to be the tighter muscle groups and the things that compensate for all the weaknesses that they've developed.
It takes a team effort to achieve desired results.
So my job is a lot of educating about why they've had this pain or why they're having this trouble, then setting up a plan how they can move forward, what they need to do at home, checking on it, making sure they're doing it correctly. And so in the beginning, the work is on me, and then it starts transitioning to both of us, and then towards the end, it's mostly on you. And then I'm here to help you with this as you need. Some people it's once a week, some people it's once every 2 weeks, some people it's once a month, some people it's once a year.
The key is to keep moving forward and build on progress.
Are they committed, not just initially, but also long-term, because there's a certain point where they now need to transition from my care to someone else, more of like an exercise physiologist or a personal trainer, and help guide them with the tools they need to know what to look for in their own bodies and pay attention to so that they're doing the exercise properly. And at that point, they'll really start to see themselves excel and move forward, and they'll start enjoying exercise because it won't be so difficult and so wearing on them.
In partnership with a chiropractor, great strides can be made on the road to an active, pain-free lifestyle.
You just have one body for the rest of your whole life, and it's important that patients realize there's only so much the physicians can do or the chiropractor or the physical therapist can do for them. They have to play an active role in what's going on to accomplish the things that most people want to accomplish when they initially come to us. It is possible to be moved from that person that looks like they're moving in pain or running in pain or doing an activity in pain to that person that looks like they're doing it easily and enjoying it. What people don't realize is how much work it takes on their part, and they have to be a part of it. You can only do so much. And so I cannot make your body stronger for you. You have to do it yourself. It's your machine.